Epione Pain Management Center. ఇక్కడ మీ నొప్పులు శాశ్వతం కావు.
Hi, I'm your Dr. Minal Chandra. I'm the co-founder and chief consultant at Epione Pain Management Center. And today I'll be talking about plantar fasciitis. So plantar fasciitis is a condition where you have pain in your sole, mostly at your heel. And early morning when you try to take the first step, it is very, very painful. And then you find it very difficult to put your foot into the floor. So what are the reasons for this plantar fasciitis pain? The first thing is your footwear. Wearing a bad footwear which is hard and you wear it for prolonged time can cause plantar fasciitis. Second thing is if you're overweight, all your body will fall there and you will not have a proper alignment. Third thing is when you walk on irregular surface continuously, you may have pain. And finally, if you have any kind of injury into the heel, that can also lead to plantar fasciitis. Now, what is plantar fascia? Plantar fascia is a thick structure into the sole. If you see your sole near the heel, you find a very hard structure. That is a plantar fascia. And when this plantar fascia gets irritated continuously, then there will be certain inflammation, or there can also be a small tear in the plantar fascia leading to this kind of pain. Now, you usually, because it is on the foot, you try to avoid it, or sometimes you try to manage it with painkillers and try to change your footwear or try to change the way you walk. And I have seen patients suffering with this plantar fasciitis for like almost 10 to 12 years, and finally they come to us because they are unable to bear it. So do not ignore this pain, because this may initially be a small pain not disturbing your daily activities, but if you ignore now, later on it may become very, very difficult to treat. So once you come to a doctor, usually in a pain clinic, what we do is we do an ultrasound scan, and this is the best way of diagnosing your plantar fasciitis, because we can map the area. Where is the damage? Whether it is just an inflammation, or whether there is just irregularity in the fibers of the fascia, or whether it is a proper tear, and then we can manage it. Now, initially, if your pain is less, your symptoms is less, and we see that there is not much any structural damage in the scan, then we can manage this with some anti-inflammatories and some lifestyle modifications and physiotherapy exercises. But if it is more, if the damage is more, if there is a tear, then you need to treat it properly. So if we go stepwise into the treatment, initially we can put you on some anti-inflammatories. We need to change your footwear, because there are special type of footwear. There are silicone rubbers which you need to insert in your shoes, or you need to change your shoes with a high cushion so that the plantar fascia is not strained. So after this, we can give you certain exercises like stretching of the plantar fascia. So if you you can stand at the stairs, at the edge of the stair, and then you can stand on your toes, and so that there is a stretching of plantar fascia. And most commonly what works the best is early morning you try to keep your foot 5 minutes in the hot water and then immediately 5 minutes in the cold water, and you do 3-4 sessions like this. This is definitely going to help you out. But you have tried all this and it's not helping you, and you go somewhere, people also give steroid shots. Now, steroid shots are not good for plantar fascia, because it may decrease your pain for some time, but again it may actually progress the damage of your plantar fasciitis. So make sure if someone is advising you for a steroid shot, do not opt for it, because it is temporary. But what is the best treatment is the plasma therapy, because this plasma has your own plasma will have lots of growth factors. We extract those growth factors and inject into that area of damage. Now, plantar fascia is a big fascia where you need to exactly inject. That is where you need the role of ultrasound. So ultrasound guided plasma therapy for plantar fascia pain is the answer for this pain which you are suffering since long, and definitely followed by certain kind of exercises. So you don't need to suffer with plantar fascia pain, because we have treatment. We are in this era where your own blood, where your own growth cells are going to regenerate it and get rid of your pain. So please do opt for this treatment and do not suffer, because your health is important to us. Thank you.